Nurse Aide Certification Practice Test. Question 1. A client with mental health issues is refusing medication. The nurse aide should: Option A. Force the client to take the medication. Option B. Report the refusal to the nurse. Option C. Hide the medication in food. Option D. Tell the client they will get worse. The correct answer is option B. Report the refusal to the nurse. Medication refusal should be reported to the nurse. Forcing, A, or hiding medication, C, is unethical and illegal. Threatening, D, is not therapeutic. Question 2. A client is pacing and appears anxious. The nurse aide should: Option A. Ask the client to sit down. Option B. Walk with the client. Option C. Give the client a sedative. Option D. Leave the client alone. The correct answer is option B. Walk with the client. Walking with the client provides exercise, reduces anxiety, and allows the aide to monitor for safety. Asking them to sit down may increase anxiety. Sedatives require an order. Leaving them alone may be unsafe. Question 3. What is the proper ratio of bleach to water for disinfecting surfaces? Option A, 1:1. Option B, 1:10. Option C, 1:100. Option D, 10:1. The correct answer is option B, 1:10. A 1:10 dilution, 1 part bleach to 9 parts water, is the standard for disinfecting surfaces contaminated with blood or body fluids. 1:100 is for general disinfection, not blood/body fluid spills. Question 4. The nurse aide should document care. Option A. At the end of the shift. Option B. As soon as it is completed. Option C. Before providing care. Option D. Only if the client's condition changes. The correct answer is option B. As soon as it is completed. Documentation should occur as soon as possible to ensure accuracy and prevent forgetting details. Delaying to the end of the shift may lead to memory errors. Question 5. What should the nurse aide do first for a client who has fallen? Option A. Move the client to their bed. Option B. Assess for injury and call for help. Option C. Document the fall. Option D. Call the client's family. The correct answer is option B. Assess for injury and call for help. Assess for injury while calling for help. Moving without assessing could worsen injuries. Documentation and family notification are secondary. Question 6. When receiving a report at shift change, the nurse aide should: Option A. Ask questions about unclear information. Option B. Write down everything quickly and leave. Option C. Ignore information about client preferences. Option D. Rely on the previous aide's verbal report only. The correct answer is option A. Ask questions about unclear information. Asking questions ensures accurate communication and safe care. Writing everything down without clarification may lead to errors. Ignoring preferences misses important care details. Question 7. A client with dementia has a tendency to wander. The nurse aide should: Option A. Place the client in a locked room. Option B. Provide a safe wandering area. Option C. Use restraints. Option D. Ignore the behavior. The correct answer is option B. Provide a safe wandering area. A safe, enclosed area for walking addresses the need to wander safely. Locked rooms and restraints are restrictive and require orders. Ignoring the behavior is unsafe. Question 8. When should the nurse aide count an apical pulse for a full minute? Option A. Always. Option B. Only if the client is pediatric. Option C. When the pulse is irregular. Option D. When the client is sleeping. The correct answer is option C. When the pulse is irregular. An apical pulse should be counted for a full minute when the radial pulse is irregular to accurately count all heartbeats. Otherwise, counting for 30 seconds and multiplying by 2 is acceptable. Question 9. Standard precautions apply to which bodily fluids? Option A. Blood and blood products only. Option B. All body fluids, secretions, and excretions. Option C. Only visible blood. Option D. only if the client is diagnosed with an infection. The correct answer is option B. All body fluids, secretions, and excretions. Standard precautions apply to all body fluids, secretions, and excretions, except sweat, regardless of visible blood, treating all clients as potentially infectious. Question 10. How long should a nurse aide rub hands together with soap and water during hand washing? Option A, 10 to 15 seconds. Option B, at least 20 seconds. Option C, 30 to 40 seconds. Option D, 1 minute. The correct answer is option B, at least 20 seconds. According to CDC guidelines, hand washing requires at least 20 seconds of vigorous rubbing to remove transient microorganisms. 10 to 15 seconds is insufficient. A full minute is not required for standard hand washing. Question 11. When is alcohol-based hand rub acceptable instead of soap and water? Option A. When hands are visibly soiled. Option B. After using the restroom. Option C. Before touching a client with clean hands. Option D. After caring for a client with C. diff. The correct answer is option C. Before touching a client with clean hands. Alcohol-based hand rub is preferred when hands are not visibly soiled. Soap and water must be used when hands are visibly dirty, after using the restroom, and when caring for C. difficile. Alcohol does not kill spores. Question 12. When disposing of contaminated linens, the nurse aide should: Option A. Shake them out before placing in the hamper. Option B. Place them in a leak-proof bag without shaking. Option C. Fold them neatly before disposal. Option D. Sort them in the client's room. The correct answer is option B. Place them in a leak-proof bag without shaking. Shaking linens creates aerosols that spread pathogens. Contaminated linens must be placed directly into designated bags without shaking, sorting, or folding. Folding or sorting would require unnecessary handling of soiled linen. Question 13. A client who is agitated and wandering should be: Option A. Restrained to ensure safety. Option B. Redirected calmly to a safe area. Option C. Left alone to tire out. Option D. Given medication to calm down. The correct answer is option B. Redirected calmly to a safe area. Redirection is the safest and most respectful approach. Calmly guide the client to a safe area and engage them in an activity. Restraints require an order and are a last resort. CNAs cannot administer medication. Question 14. What is the most important action a nurse aide can take to prevent the spread of infection? Option A. Wearing gloves at all times. Option B. Performing hand hygiene. Option C. Wearing a mask. Option D. Isolating all clients. The correct answer is option B. Performing hand hygiene. Hand hygiene is the single most effective measure to prevent healthcare-associated infections. Gloves, masks, and isolation are important but do not replace hand washing. Hand hygiene breaks the chain of infection at the most common transmission point. Question 15. The nurse aide should speak to a client who is hearing impaired by: Option A. Speaking very loudly. Option B. Speaking slowly and clearly while facing the client. Option C. Writing everything down. Option D. Asking a family member to translate. The correct answer is option B. Speaking slowly and clearly while facing the client. Speaking slowly and clearly with normal volume and facing the client allows lip reading and visual cues. Shouting distorts sound and is uncomfortable. Writing everything down may not be practical. Question 16. When providing care for a client from a different culture, the nurse aide should: Option A. Follow standard procedures regardless of culture. Option B. Ask the client about their preferences and respect them. Option C. Assume cultural preferences based on the client's appearance. Option D. Ask the nurse to provide care instead. The correct answer is option B. Ask the client about their preferences and respect them. Asking the client about their cultural preferences shows respect and enables culturally competent care. Following standard procedures without regard for culture may be insensitive. Making assumptions based on appearance can lead to stereotypes. Question 17. When communicating with a client with dementia, the nurse aide should: Option A, use complex medical terms. Option B, use simple, one-step directions. Option C, speak loudly. Option D, ask open-ended questions. The correct answer is option B. Use simple, one-step directions. Simple, one-step directions, example, please sit down, are most effective. Complex terms, open-ended questions, and loud tones are overwhelming and may cause agitation. Question 18. Which statement demonstrates therapeutic communication? Option A, you should not feel that way. Option B, everything will be fine. Option C, tell me more about what happened. Option D, I know exactly how you feel. The correct answer is option C. Tell me more about what happened. Tell me more is an open-ended question that encourages expression, demonstrating therapeutic communication. You should not feel that way is judgmental. Everything will be fine is false reassurance. I know exactly how you feel assumes identical experience. Question 19. When dressing a client with a weak right arm, the nurse aide should: Option A, dress the right arm first. Option B, dress the left arm first. Option C, dress both arms simultaneously. Option D, dress the stronger arm first. The correct answer is option B. Dress the left arm first. Dress the stronger arm, left, first, then the weaker arm, right. This minimizes discomfort and strain on the weak arm. Dressing the weak arm first would require moving it more. Question 20. A client with Alzheimer's disease becomes agitated when the nurse aide enters the room. The aide should: Option A, leave and return later. Option B, approach slowly and speak in a calm, soothing voice. Option C, ask the client what is wrong. Option D, call for assistance. The correct answer is option B. Approach slowly and speak in a calm, soothing voice. A calm, slow approach reduces agitation. Leaving may reinforce the behavior. Asking what is wrong may be too abstract. Calling for assistance may be needed if the client is a danger to self or others. Question 21. A client is in the active dying process. The nurse aide should: Option A, avoid the client. Option B, provide comfort measures. Option C, stop all care. Option D, leave the client alone. The correct answer is option B. Provide comfort measures. Comfort measures such as repositioning, mouth care, and emotional support are essential at the end of life. Avoiding or leaving the client alone is not appropriate. Stopping all care would be neglect. Question 22. Which is a violation of HIPAA? Option A, discussing client care with the client's family who is present. Option B, discussing client information in the elevator with another aide. Option C, documenting care in the client's chart. Option D, reporting client information to the nurse. The correct answer is option B. Discussing client information in the elevator with another aide. Discussing client information in public areas, elevators, cafeterias, hallways, violates HIPAA because conversations can be overheard. Discussing with family present, documenting, and reporting to the nurse are HIPAA compliant. Question 23. What does it mean when a client is placed on droplet precautions? Option A. The client must be in a negative pressure room. Option B. The nurse aide must wear an N95 respirator. Option C. The nurse aide must wear a surgical mask within 3 feet of the client. Option D. The client cannot leave the room. The correct answer is option C. The nurse aide must wear a surgical mask within 3 feet of the client. Droplet precautions are used for infections spread by respiratory droplets. These droplets travel up to 3 feet, so a mask is required within that distance. Negative pressure and N95 are for airborne precautions. Question 24. A dying client requests to see their pastor. The nurse aide should: Option A, tell the client the pastor is busy. Option B, contact the facility chaplain. Option C, change the subject. Option D, tell the client to pray alone. The correct answer is option B. Contact the facility chaplain. Spiritual support is important at the end of life. The nurse aide should contact the chaplain or the client's clergy. Dismissing the request is inappropriate. Changing the subject avoids the client's needs. Question 25. How should the nurse aide communicate with a client who has a hearing loss? Option A. Face the client when speaking. Option B. Repeat the statement. Option C. Shout so that the client can hear. Option D. Use a high-pitched voice. The correct answer is option A. Face the client when speaking. Facing the client when speaking allows them to read lips and see facial expressions, which aids communication. Shouting distorts sound, and high-pitched voices are often harder to hear for those with hearing loss. While repeating may be necessary, facing the client is the primary strategy.